All right, welcome back to the Sports Wrap. Pleased to be joined now by Dr. Paul Fadale of University Orthopedics. Doctor, well-timed visit as usual. Let's get right to it, right to the point. Do you think, or is it possible to speculate whether or not Rob Gronkowski will play in the Super Bowl?
Yes, and boy, did we get lucky. We have 2 weeks now. So he was taken out, and there's an NFL protocol. He's got to stick with it. And they're going to let him rest for until his head clears, because there were some rumors he took a pretty good hit and was a little confused in the locker room. He's going to rest. He's going to do some light practices, and they have to go through a stepwise progression. That takes 5 days minimum. So if he's going to play next week, boy, we're on a tight course. 2 weeks later, we have some breathing room. They don't have to push him so hard. They can take a week off if they have to before they go through their protocol. So you don't want to see anyone get hurt, but this was as good a time to get a concussion as there is.
Is it likely he plays? Can we even talk about that medically?
And that's the hard part, because we don't have good tools to measure. So you know that. We're down in the locker room. We're giving them some neurocognitive testing that they can kind of fudge a little bit. And you ask the athlete, how are you doing? Well, no athlete who's got a Super Bowl out there is going to tell you, I'm woozy, I'm tired, I have blurry eyes, a little headache. So it's really hard for that medical staff to say, oh, absolutely, he's cleared to play. In fact, it's an art to figure these guys out. So I'm thinking this 2-week time period is going to give that medical staff a lot of breathing room to make sure he's safe.
And just clarify for us, is this the Patriots medical staff that's making this determination? Is it the NFL? Is both parties involved?
Right. There's supposed to be some independent physicians as part of this, because that's the problem, where you can fudge a lot of this and say, you know what, he's good enough. And you and I have been around athletes who clearly are still concussed and they're out playing again. They don't want that anymore because there's too high a risk.
Okay, so the 2 weeks obviously a help here. We'll see. You know he wants to be out there after missing the Super Bowl last year. I mean, this guy.
That's the trick. It's almost impossible to keep this guy out, so he's really going to have to struggle, but we count on him giving us the answers. So if we put him on an exercise bike and he gets off, he starts getting a little woozy again, he's not going to tell anyone, potentially, because he wants to play.
Okay. Before we go forward, I just want to look back real quick. Tom Brady, the hand injury, now that we know it was some kind of cut right around, in this area here. What did you make of the whole injury, how it progressed, and then ultimately how it played out?
I'm not so sure what they're even talking about, because he said it got bent back. It didn't get hit on anything. If your thumb gets bent that far back, there has to be some ligament damage, which he didn't have. So you do wonder if something just cut him or tore some of that tissue. The bad news is very bloody, so it's going to look horrible if it occurred. The good news is very bloody. It's going to heal relatively fast. So in that area, it should be okay. Sutures will be out. He should be good to go. So again, they got a little lucky on that one.
Non-issue, hopefully, for the Super Bowl at hand.
I think so.
Last thing before we let you go, we obviously wanted to zero in on the Gronk stuff, but Carson Wentz, the starting quarterback for the Eagles, out for the year, as we know, but suffered an ACL injury, a tear, I believe, in midair. He was diving for a touchdown, and two defenders kind of just came at his legs. And have you seen anything like? Is that common? I mean, that was crazy.
You're right on it. It is incredibly uncommon. So if you look at ACL tears in general, non-contact injuries, plant, twist, turn, that's probably 70 to 80% of them. The Gronkowski hit, direct trauma, that's probably 20 to 30%. Floating in midair, going one way and another, exceedingly uncommon. So if you look at that in slow motion, that guy was coming at him, but his leg was off the ground. Like a missile hit him just hard enough to bend it.
Unbelievable. You got to figure that the Eagles have to be kicking themselves, although Nick Foles looked great in the NFC Championship game.
Right.
So we expect a very competitive Super Bowl. As always, Dr. Paul Fadale, a pleasure to have here on the Sports Wrap. Doctor, thanks very much.
Thank you, Mark.
We'll be right back.